They laughed when she walked into the trauma bay, not behind her back, openly, the way people do when they've already decided someone doesn't belong. She was 31 years old, 5'4", and wearing blue scrubs with a name badge that said Claire Bennett, RN. The charge nurse smirked. The attending physician didn't even look up. Chief Administrator Grant Holloway stood in the corridor with his arms crossed and told her, loudly enough for the whole department to hear, that she was just a nurse and that she needed to remember her place. Then the ambulance doors blew open, and the dying Marine inside, bleeding from 3 wounds, barely conscious, blood pressure crashing, forced his shaking body upright, locked eyes with Claire across the chaos of the bay, and raised his right hand in a slow, perfect military salute. He didn't say a word. He didn't have to. If this story stays with you, follow along until the end. Like this video, drop a comment with the city you're watching from. I want to see how far this story has traveled. The morning started the way most bad days do, quietly, with no warning at all. Claire Bennett clocked in at 6:48, 12 minutes before her shift technically began, because she had never once in her life been able to show up exactly on time to anything. Early or late, never right on the dot. Her mother used to say it was a character flaw. The Army had tried to beat it out of her. Neither had fully succeeded. She poured herself coffee from the break room machine, the kind that tasted faintly of burnt plastic no matter what button you pressed, and she drank half of it standing at the counter before anyone else arrived. Redstone Memorial Medical Center was not a prestigious hospital. It occupied a blocky concrete building in the older part of Ashford City, sandwiched between a parking structure and a discount pharmacy, and it smelled the way all hospitals smell, antiseptic over something else, something you tried not to name. The emergency department took up the entire east wing of the ground floor, and on a busy night, it was controlled chaos. And on a slow night, it was the kind of quiet that made experienced nurses nervous, because quiet in an emergency room was never really quiet. It was just the pause before something arrived. Claire had been working at Redstone for 2 years and 4 months. She knew the rhythms of the place the way she'd once known the rhythms of a Ford operating base, which machines made which sounds, which doctors went silent when they were uncertain, which orderlies could actually be counted on in a crisis, and which ones would disappear. She kept her head down. She did her work. She did not talk about where she'd been before nursing school, and the staff had long since stopped asking. That was the arrangement she'd made with herself when she came back from overseas. Forward, not backward. Civilian life required a kind of selective amnesia, and she had gotten reasonably good at it. What she had not gotten good at was Grant Holloway. He was in the hallway when she came out of the break room, already holding a tablet and already wearing his expression, the one that communicated, without any specific words, that he had found something to be displeased about and was looking for somewhere to put it. Holloway was 47, with the build of a man who had once been athletic and the manner of a man who wanted you to remember it. He had an MBA and a healthcare administration degree, and he talked about operational efficiency, the way other people talked about weather, constantly, reflexively, without much actual conviction behind it. He looked at Claire the way he always looked at Claire, like she was something that had been placed in the wrong filing cabinet. Bennett. He didn't say good morning. He never did. I need you in conference room B at 9. I've got a full patient load starting at 7. Reassign where you can. 9 o'clock. He was already walking away. She knew what 9 o'clock meetings meant. She'd been to 2 of them in the past 8 months. The first was a formal reprimand for, in Holloway's phrasing, exceeding her clinical scope, when she'd identified a tension pneumothorax that the on-call resident had missed and intervened before waiting for physician authorization. The patient had lived. Holloway had written her up anyway. The second meeting had been a warning about patient interaction protocols after she'd spent 40 minutes with a veteran who was refusing treatment, talking him through it, getting him to agree to the procedure. She had been told that her time was better spent elsewhere. Both times, she had sat across from Holloway and his HR coordinator and a woman from legal whose name she never learned, and she had listened without raising her voice, and she had signed whatever they put in front of her, and she had gone back to work. She was not naive. She knew what he was doing. She just hadn't figured out why yet. By 8:15, the morning had found its rhythm. 2 chest pains, 1 pediatric asthma case, a broken wrist from a cycling accident, and a woman in her 70s who had fallen in her kitchen and was more embarrassed than injured. Claire moved through all of it with the slightly automatic efficiency of someone who had been doing this long enough that the clinical decisions happened a half-second before the conscious thought caught up. She was adjusting a drip line for the chest pain in Bay 4 when her colleague Priya Okafor appeared at the curtain. Priya was 35 and had been at Redstone for 6 years and was one of maybe 4 people in the building Claire actually trusted. She had a look on her face that Claire recognized. Bad news, delivered carefully. "You hear anything about the 9 o'clock?" Priya asked. "Not specifics." "People are talking." Priya lowered her voice, though there was no particular reason to. "Holloway's been meeting with the new trauma attending, Kowalczyk, and someone from administration 3 times this week." Claire adjusted the drip line without looking up. "What kind of meetings?" "The kind where they close the door." That was all Priya said. It was enough. The conference room at 9 o'clock had 4 people in it. Holloway, the HR coordinator whose name Claire now knew was Diane, a man she didn't recognize who wore a lanyard from the hospital's legal office, and Dr. Richard Kowalczyk, who had arrived at Redstone 6 weeks earlier from a hospital in the Mid-Atlantic region and had immediately made clear that he intended to restructure the trauma department in ways that had not yet been fully specified. Claire sat down. She did not take coffee from the carafe on the table. She put her hands flat on the surface and waited. "We're making some changes to the emergency trauma team composition," Holloway began. He had the delivery of someone who had rehearsed this, which made it worse somehow. "Effective immediately, we're adjusting staffing assignments to better align with Dr. Kowalczyk's clinical protocols." "What does that mean for my assignment?" Holloway exchanged a brief look with Diane. "You're being reassigned out of the trauma bay." "To where?" "General medical floor, 3rd floor, starting tomorrow." Claire kept her hands flat on the table. "I've been in emergency trauma for 2 years. I'm the most experienced trauma-certified nurse in this department." "That's not really the relevant metric," Kowalczyk said. He had a mild, uninflected voice that somehow made everything he said land harder. "I'm restructuring the team around a specific care model. It requires nurses who are trained in certain institutional protocols." "I can be trained." "It's not about training." A pause. "It's about fit." She looked at him for a moment. Then she looked at Holloway. "Is there a clinical reason for this, or is this administrative?" "It's operational," Holloway said. "Those aren't the same thing." "Bennett." Holloway's tone shifted, not quite threatening, but close enough to see from there. "You've had 2 formal disciplinary actions in 8 months. You have a pattern of operating outside your defined clinical scope. The decision's been made. This conversation is a courtesy, not a debate." She thought about asking what patient care would look like if you removed the only trauma-certified nurse with actual field experience from the trauma bay. She thought about pointing out that both disciplinary actions had ended with patients alive who might otherwise not have been. She thought about a lot of things she did not say. "Is there a formal grievance process?" "There is," Diane said. "You'll receive the documentation." "Fine," Claire stood. "I'll finish my shift today." "Actually," Holloway said, and something in his voice made her stop. "We'd like you to hand off your current patients to Priya and go ahead and clear your locker this morning." The room was silent for 3 seconds. "You're removing me mid-shift. We'd like a clean transition." She looked at him for a long moment. He did not look away, which was the only interesting thing about him. "All right," she said, and she left. Priya was waiting outside. She had clearly been listening, or at least waiting close enough to have heard the general shape of it. She fell into step beside Claire without a word, and they walked back to the trauma bay together, and Claire began the handoff in the methodical, organized way she did everything: vitals, notes, current medications, anything the next nurse needed to know. She did not rush it. She did not shortcut anything. The patients deserved the same care in her last 30 minutes as they had gotten in the first 7 hours. When she got to her locker, she packed her things in the small bag she always kept there: a spare set of scrubs, a water bottle, a book she'd been meaning to read for 3 months, a photograph she kept face down, which she left face down. She unclipped her badge and held it for a moment. Priya was leaning in the doorway. "This is wrong," she said. "Probably." You should fight it. Maybe. Claire set the badge on the shelf. Tell Martinez his INR needs to be rechecked at noon. He'll want to skip it. Claire, just tell him. She picked up her bag. I'll be fine. She was almost to the exit when the radio on the security desk crackled, and then she heard the overhead tone, not the standard call tone, but the other one, the one that meant incoming critical, and before the announcement even finished, she had stopped walking. Incoming trauma, male, late 20s, multiple GSW to chest and abdomen, BP dropping, ETA 90 seconds. She stood there with her bag over her shoulder and her badge sitting on a shelf 20 feet behind her, and she did not move. The ambulance bay doors were directly ahead. She heard Priya's voice somewhere behind her. Claire? The bay doors blew open. The paramedics were moving fast, which was normal, but they were also talking fast, which meant something was wrong beyond the obvious. The patient was on a backboard, oxygen mask in place, 2 IVs already running. Claire saw the wounds in the first second, chest and upper abdomen, compressed dressings already soaked through. And in the second she saw the tourniquet on his left arm and the specific way it had been applied, and something in the back of her mind registered a recognition that had nothing to do with nursing. The trauma bay erupted into its standard controlled chaos. Kowalczyk was already there, gowned, directing the team. 2 nurses she didn't know well, Rodriguez and the new one, Kim, positioned themselves at the bedside. The paramedic called out vitals. BP 70 over palp, heart rate 140, O2 sat dropping. BP's too low for his size, Claire said. She hadn't meant to say it out loud. Kowalczyk glanced over his shoulder. What are you doing in here? You're not on this team. His pressure's too low. The wounds don't account for it. He's bleeding somewhere else. Bennett, you need to leave this bay. Listen to me. She stepped forward. The external wounds are bad, but they're manageable. Something else is happening. You need to look at security. Kowalczyk said it without raising his voice, the way someone calls a dog. Get her out. She heard movement behind her, the security guard from the main desk, coming fast. She looked at the patient on the table. His color was wrong. His abdomen was distended on the left side in a way that wasn't consistent with the wound location. She had seen this before. Not in a hospital. She had seen this in a field. He's got a concealed hemorrhage, she said, louder now. Left upper quadrant, internal. It's not showing on the surface assessment. Dr. Kowalczyk, Rodriguez said, and his voice had a different quality. His pressure just dropped again, 60 over palp. A pause of maybe 2 seconds, which in a trauma room is a very long time. And then the patient's eyes opened. He was barely conscious. He had to be running on something the rest of his body had already stopped producing. His oxygen mask was fogged with shallow breath, and the monitors were screaming, and the room smelled like blood and antiseptic, and the specific adrenaline-tinged tension of a situation that was becoming unrecoverable. His eyes were glassy, unfocused, moving across the ceiling, and then they moved to her. Something in him stopped. His face changed. She watched it happen. The recognition that moved through him like current, underneath the shock and the blood loss and the pain, something older and deeper than all of it. And then with a movement that should have been physically impossible given everything his body had been through, Staff Sergeant Nolan Briggs raised his right arm off the gurney, shaking with effort, and lifted his hand into a slow, precise military salute. The room went absolutely silent. Not quiet. Silent. Every monitor kept beeping, every machine kept running, but the human sound in the room, the voices and the movement, and the urgent professional noise of people working, stopped completely. The security guard stopped walking. Kowalczyk stopped talking. Rodriguez and Kim stood motionless at the bedside. Briggs held the salute for 3 full seconds. His arm was trembling. His blood pressure was 60 over palp. He held it anyway. Then his arm dropped and his eyes closed, and the monitors went from urgent to critical. Claire was already moving. She didn't ask permission. She didn't wait for Kowalczyk to step aside. She moved to the left side of the gurney, physically past Rodriguez, and put her hands on the patient's abdomen with the specific experienced pressure of someone who had done this assessment in conditions that made a trauma bay look like a library. Here, she said, feel this. The rigidity is left of midline, not where the wounds are. This isn't wound-related bleeding. This is a separate injury. He's got a ruptured spleen or hepatic tear, something that happened before the GSW. Old injury reopened or blunt trauma he didn't report. Bennett, Kowalczyk started. His pressure will not respond to volume resuscitation if you don't address this, she said, and she did not raise her voice, and the steadiness of it was somehow more commanding than shouting. He will die on this table, right now, while we're standing here. The monitors screamed. Kowalczyk looked at the readout. He looked at the patient. He looked at Claire. Get ultrasound in here, he said. Not to her, to Rodriguez. But it was what she'd asked for. The ultrasound confirmed it 40 seconds later. Significant free fluid in the left upper quadrant, consistent with splenic laceration. The external wounds alone had been survivable. The internal hemorrhage was not going to be, not without immediate surgical intervention. While Kowalczyk was calling the OR, Claire was adjusting the IV lines, flagging the blood type, talking to Kim in a quiet, rapid sequence of clinical instructions that Kim, to her credit, followed without asking who had authorized any of it. The security guard was still standing 3 feet away, his hand not quite raised, his face wearing the expression of someone who had been given an instruction that no longer clearly applied. Holloway arrived 6 minutes after the ambulance did. He came in through the side corridor and stopped when he saw Claire at the bedside. What is she still doing here? His voice had the edge of someone who was genuinely surprised but translating it into anger because anger was more manageable. She identified a secondary hemorrhage, Rodriguez said carefully. I don't care what she identified. She is not authorized. Mr. Holloway. Kim spoke without looking up from what she was doing. She was 26 and had been at Redstone for 8 months and had never in that time said anything directly to Holloway. The patient is going to the OR. Can you please move? The team moved past him. Claire was the last one out of the bay. She stopped at the door and turned back to where Holloway was standing, alone in the suddenly quiet space with the detritus of the trauma still visible, the bloody compresses, the IV packaging, the ultrasound still showing its images on the screen. She looked at him for 1 second, then she followed her patient to surgery. Outside the hospital, no one inside had noticed yet, 3 black government SUVs had pulled into the ambulance bay and stopped in a way that blocked 2 exits. The men who got out were not wearing uniforms, but they moved like people who had worn uniforms for a long time. They showed identification to the security desk and asked, in the specific professional way of people who expected immediate compliance, to speak with the charge administrator. And then they asked for Claire Bennett, not the patient, not the doctors. Her. Inside the OR prep area, Claire was scrubbing her hands with the focused attention she brought to everything, and she did not yet know about the SUVs, and she did not yet know about the men with the federal credentials asking for her by name. She knew that Briggs was still alive. She knew that his pressure had stabilized enough to take to surgery. She knew that she had done what she came to a hospital to do every day, and that it had probably cost her the job she had, and that she was going to deal with that when she had to deal with it. What she did not know, what none of them knew yet, was that Staff Sergeant Nolan Briggs was not simply a Marine, and Claire Bennett was not simply a nurse, and the events of the next 6 hours were going to make everything that had happened in the trauma bay this morning look like a prelude. The men waiting for her were not subtle about it. There were 4 of them in the corridor outside OR prep, and they had the particular quality of stillness that Claire recognized immediately. Not the stillness of patients, but the stillness of people who had learned to stop fidgeting because fidgeting got you killed. 2 were in plain clothes, dark jackets, federal credentials already visible on lanyards. 1 was in a suit that was slightly too expensive for a civilian hospital visit. The 4th was in military dress uniform, Army, senior rank, silver on his collar, which was the kind of thing that made hospital staff in the corridor stop what they were doing and try not to stare. The one in the suit spoke first. Miss Bennett. Not a question, not a greeting exactly, just her name, used the way you use something you've been carrying for a while. I'm about to scrub in, she said. We know, the surgery's covered. Dr. Vargas is taking lead. He paused. She's good. He'll be fine. Claire looked at him for a moment. She looked at the uniform, at the credentials, at the careful arrangement of 4 people who had clearly positioned themselves so that none of the exits were convenient. She had been in enough situations to know when a conversation wasn't optional. "Then let's talk," she said. They used the small family consultation room off the main corridor, the one with the box of tissues on the table and the painting of a beach that nobody had ever asked for. Claire sat down. The suited man, who introduced himself as Special Agent Darren Mace from a federal oversight office he named with enough acronyms that she didn't catch all of them, sat across from her. The uniformed officer, Colonel James Tate, he said, and he said it the way senior officers say their own rank, like a fact and not an introduction, sat to the left. The other two remained standing near the door. Mace opened a folder on the table. Inside was a photograph. Claire looked at it without reaching for it. It was her, younger, in uniform, in a place that was clearly not a hospital. "You listed prior service on your nursing school application," Mace said. "Army medic, 4 years. Honorable discharge." "That's accurate." "You left out some details." "I listed what was relevant." Tate spoke then, and his voice had the flat, matter-of-fact quality of someone who had given a lot of briefings. "We're not here to cause you problems, Sergeant Bennett. We're here because the man in your OR right now is carrying information that certain people would prefer stayed buried, and his being alive and conscious in a public hospital creates a specific situation." She registered the rank sergeant, but didn't correct him. It wasn't incorrect, technically. It was just old. "What kind of situation?" "The kind," Mace said, "where we need to know who in this hospital has had contact with him, who's been alerted to his presence, and whether anyone made calls in the last 40 minutes that they shouldn't have." "You think someone tipped someone off?" "We think it's possible." He closed the folder. "We also think you recognized him." She was quiet for a moment. The beach painting was directly in her eye line, and she focused on it briefly, the way she used to focus on fixed points when she needed to keep her breathing even. "I recognized the way the tourniquet was applied," she said finally. "It was field technique, specific protocol, not standard civilian or even standard military." "Joint Special Operations Rescue," Tate said. "Yes." "And you knew that because I trained with those teams." She said it flatly, without color. "For 18 months before my discharge. That's what's in the file you're not showing me." Mace and Tate exchanged a look that was brief and communicated more than either of them probably intended. "There's a little more in the file than that," Mace said. She waited. "Operation Ashgrave." He watched her face when he said it. "Korengal adjacent. 47 hours, 4 Marines, 1 compromised extraction point." The consultation room was very quiet. Down the hall, someone was paging a physician overhead, the sound muffled and distant. Claire's hands were on the table, and she did not move them. "I don't discuss that," she said. "We know. Nobody does. That's part of the problem." Mace leaned forward slightly. 3 of those 4 Marines are alive. All 3 of them, at different points in their post-service lives, have had anomalous medical encounters. Situations where they required emergency care and where the official paperwork afterwards was incomplete. Missing records, closed files. One of them died 8 months ago, officially a cardiac event. We have reason to believe otherwise. Something shifted in the room, though nothing physically changed. "You're saying someone is targeting them," Claire said. "We're saying we have a pattern we can't fully explain yet." He paused. "And we're saying that Briggs coming here, to this hospital, to your department specifically, may not be coincidental." "He didn't come here," she said. "He was brought here, by paramedics, after a shooting." "We know." "Then you know that's not a choice he made." "We know that too." Mace's voice didn't change. "What we don't know is who made the call that brought him to this hospital instead of Mercy General, which was closer, or Lakefield Trauma, which has a better GSW protocol. Redstone was the 3rd closest option. Someone made a routing decision." Claire sat with that for a moment. She thought about the paramedics, the way they'd been talking fast, the look they'd exchanged when they came through the bay doors. She'd attributed it to the severity of the case. She thought about whether she'd been wrong. "You need to talk to the paramedics," she said, "already happening." He stood, which was her indication that the first part of this conversation was over. "We'd like you to stay in the building. Not under restriction, you're not a subject, but available." "I have a patient in surgery." "Vargas has it," Tate said. But if something changes and they need you, we'll get you there. We have someone in the OR observation deck." She looked at him. "You moved fast." "We were already moving," he said, and that, more than anything else that had been said in the last 20 minutes, was the thing that stayed with her. The waiting was the hardest part. It always had been. In the field, waiting was the enemy. It was the space where things went wrong, where shock set in, where the situation evolved faster than you could track. In a hospital, theoretically, waiting was controlled. There were chairs, there was overhead paging. Someone had put a coffee station in the family waiting area near the surgical suites, the kind with individual pods, and Claire made herself use it because standing still with nothing in her hands was not something she did well. Priya found her there 20 minutes into the wait. "Security is telling people to stay on their floors," Priya said. She was keeping her voice low, though the waiting area was mostly empty. "And there are men in the parking structure." "I know." "Who are they?" "Federal." Priya was quiet for a moment, processing this. "This is about your patient." "And some other things." Claire drank her coffee. It was better than the break room machine, which wasn't saying much. "How's the floor?" "Holloway's been in his office since you went to surgery. He came out once, talked to someone on his phone in the stairwell, went back in." Priya paused. "He looks scared." "Holloway always looks scared. He just usually frames it as authority." "No, I mean—" Priya stopped. This was different. He looked actually scared, like something had happened. Claire set her cup down. She thought about what Mace had said. Someone made a rooting decision, bringing Briggs here. She thought about Holloway's face in the trauma bay, not just angry but surprised in a particular way, the way people look when a situation has moved past where they thought it was going. She thought about 3 closed conferences in a week, Holloway and Kowalczyk and someone from legal, and about Kowalczyk's specific instruction to remove her from the trauma team, not just reassign her, but remove her mid-shift, today, now. Today. The same day Briggs arrived. She didn't say any of this to Priya. She said, "Do me a favor. Don't go into Holloway's office for any reason. And if he asks you anything about me, anything at all, come find me first." Priya looked at her steadily. "Claire, what is happening?" "I don't know yet." She picked her cup back up. "But I think it's been happening for a while and we just didn't see it." The call from the OR came at 11:42. Not a problem call, a completion call. Briggs was out of surgery stable, being moved to the ICU. Dr. Vargas had handled the splenic repair and addressed both GSW wounds. Expected recovery was 6 to 8 weeks minimum, longer given the prior damage they'd found during the procedure. Old scar tissue, healed injuries that had never been properly documented in any medical record Redstone had on file, which meant either he'd received care off book or he'd received no care at all. Claire was back in the consultation room when Mace came in with this information. Tate was on a call in the corridor. She could see him through the narrow window in the door, standing very still, which she had come to understand meant something was developing. "The paramedics," she said, before Mace could start. He sat down. The careful expression on his face had shifted slightly, not cracked, but adjusted. "One of them is clean. Young, 2 years on the job, she doesn't know anything beyond the call she responded to. The other one," a pause. "The other one made a phone call from the ambulance bay before they transferred Briggs, to a number registered to a shell company with connections we're still tracing. He's been detained." "So someone knew Briggs was here." "Someone knew within the first 8 minutes of his arrival, yes." She thought about what that meant. 8 minutes. Before she'd been escorted out. Before Holloway had appeared in the bay. "Holloway," she said. Mace looked at her without visible reaction. "He wasn't surprised that Briggs was here," she said, working it out as she spoke. "He was surprised by how it went. He expected me to be gone before the ambulance arrived. He moved the meeting to 9. He wanted me out with my locker cleared and off the premises by—" She stopped. He timed it wrong. "I was still in the building." "We've been looking at Holloway for about 6 weeks, Mace said carefully. The word 6 weeks landed in the room like something dropped. "Then you knew," she said. "When you came here this morning, you already knew about him." "We knew some things. We needed more. You let him move to fire me without—" We didn't know he was going to do that today. Something in Mace's voice shifted just slightly. His actions this morning were not anticipated. They're actually useful to us, but he stopped himself. We understand if that's not comforting. Claire was quiet for a moment. The beach painting was on the wall in this room too, she realized. Maybe they'd bought them in bulk. What has he done? She said. It wasn't a question exactly. It was the shape of a question. Mace opened the folder again. This time he turned it toward her. The first page was a financial document. Allocation records, federal veteran health care funding, numbers that ran into the 7 figures. The second page was a comparison. What Redstone had reported receiving for veteran patient care versus what it had actually processed. The gap between the two numbers was not small. He's been siphoning veteran medical funding, Mace said, falsifying treatment records to claim reimbursements for care that was never provided or was provided at a fraction of the reported cost. The money moves through 3 intermediary accounts before it surfaces anywhere traceable. He paused. The veterans in question, the ones whose records were falsified, many of them are patients who were discharged quickly, who have complicated or classified service histories that make follow-up difficult, who don't have family advocates pushing for accountability. She looked at the numbers on the page and felt something tighten in her chest that was not grief and was not anger, but was the specific thing that exists in the space between them. He picked veterans because their records are harder to access, she said, and because they're less likely to complain to the right people, and because a certain percentage of them have service-connected conditions that can be plausibly documented as progressing or resolving without intervention. How long? Best estimate, 4 years, possibly 5. She put the document down. She looked at the door, at Tate still on his call in the corridor, at the movement she could see at the far end of the hallway. More people arriving, more lanyards, more of the deliberate, purposeful movement that meant things were accelerating. Kowalczyk, she said. Is he part of it? We believe he was brought in to restructure the trauma department specifically to reduce the number of staff who might notice the billing discrepancies. Nurses with military backgrounds, nurses with field experience who would recognize when a veteran's charted treatment didn't match their actual presentation. Mace paused. Nurses like you. She sat very still. They flagged you 8 months ago, he said. After your first disciplinary action, your record from the Army wasn't fully accessible to them, but the pattern of your clinical interventions was enough to make you a liability. Every time you caught something that shouldn't have been there, every time you spent extra time with a veteran patient, you were getting closer to seeing what the records were hiding. They've been trying to push me out for 8 months, she said slowly, because they were afraid I'd notice the charts. Yes, she almost laughed. It came out as a breath, short and humorless. 8 months of disciplinary meetings and reassignments and Holloway's flat disregard. 8 months of being told she exceeded her scope and overstepped her role. And the whole time the thing she'd been getting close to wasn't a protocol violation. It was a federal crime. There's one more thing, Mace said. His tone was different enough that she looked up. Briggs was not randomly shot. He said it plainly, without buildup. We believe he was targeted. The shooting is connected to what's been happening to the other Marines from Ashgrave. Someone has been working to eliminate the people who could connect certain events from that mission to certain financial irregularities in a much larger system than just this hospital. The consultation room felt very small. What financial irregularities? She said. Mace closed the folder. That's the part we're still working on. But the Redstone funding scheme, Holloway's operation, we think it's a local piece of something bigger. And Briggs, if he recovers and becomes able to testify, could connect the local piece to the larger structure in ways that certain people cannot afford. She looked at him for a long moment. Is he safe? In the ICU? We have people on the floor. That's not what I asked. Mace met her eyes. We believe so. For now. For now was not the same as yes. She knew that. He knew she knew that. Down the corridor, Tate ended his call. He came to the door of the consultation room and opened it without knocking, and the look on his face was the kind that had no diplomatic cushioning left in it. We have a problem, he said. Mace looked at him. Holloway. Tate's voice was level, but only by effort. He's gone. What do you mean, gone? His office is empty. His car is still in the parking structure. He left his phone on his desk. A pause. Someone walked him out of this building in the last 40 minutes, and none of our people saw it happen. The room was silent. Claire stood up. Claire was already moving toward the door before Tate finished his sentence. "Where are you going?" Mace said. "The ICU." She didn't slow down. If Holloway's been walked out by someone, then someone in this building helped make that happen. And if they're cleaning up loose ends, Briggs is at the top of the list. Mace was beside her in 3 strides. "We have agents on the floor." "How many?" A pause that was 1 beat too long. 2. "And how many exits does the ICU have?" He didn't answer that. The corridor to the ICU wing was on the 2nd floor, accessible by elevator or by the east stairwell, and Claire took the stairs because she always took the stairs in a hospital when speed mattered, because elevators required waiting and waiting required faith that the situation would hold, and she had stopped operating on that assumption approximately 40 minutes ago. Tate was on his radio behind her, Mace was on his phone, and the 2 plainclothes agents from the consultation room were somewhere behind them all. And the whole procession moved through the stairwell with the particular controlled urgency of people who understood that running was for civilians and panic was for people who hadn't planned, but who were also very aware that time was doing something unfriendly. The ICU floor was quiet in the way that ICU floors are always quiet. The sound turned down, the light slightly dimmer, the whole atmosphere calibrated for fragility. The nursing station was centered, with 8 individual rooms radiating from it in a horseshoe arrangement. Claire scanned it in the first second. 1 agent visible near room 6, another near the station. 2 nurses she didn't recognize. A physician she'd seen around the hospital but couldn't name. Briggs was in room 4. She went to the window first before entering. He was on the vent, sedated post-op, vitals on the monitor above the bed. BP stable, heart rate in the low 70s. The monitor showed what they should show, and the lines in his arm were properly placed, and nothing in the room looked immediately wrong. She let out a breath she hadn't realized she'd been holding. "He's okay?" she said, more to herself than to Mace. "For now." Mace had caught up. He was studying the room through the window with the same clinical attention she'd used, just reading different indicators. "My concern is less immediate and more systematic," she said. "I know. Someone in this hospital fed information about his presence here. Someone helped Holloway leave without being seen. Those are 2 different actions, which suggests at minimum 2 people still inside this building who are working against us." He kept his voice low, level, the particular register of someone managing a situation they had not fully mapped yet. "We're locking the building down now. Full. No one in or out without clearance. The patients, emergency cases are being rerouted to Mercy General. Non-critical transfers are paused." He glanced at her. "It's going to be a difficult conversation with the medical staff." "It's going to be more than difficult." She turned away from the window. "You're telling doctors they can't transfer critically ill patients. That's going to go over like..." "I know." His voice didn't change. "It's temporary." She started to say something about what temporary means when someone is depending on a medication schedule or a specialist appointment or a surgical window, and then she stopped because she understood that he understood this and that the calculation had already been made, and she was not going to change it in the next 30 seconds. Sometimes you worked with the situation you had. What she needed to do was be useful. "The nursing staff," she said. "You said someone inside fed information. If it was a nurse, it would have to be someone with access to the intake system. Who can see incoming ambulance routing, patient assignment, bed placement?" She was thinking while she was talking, which was not her best habit, but was unavoidable. "Intake is logged. Pull the access records for the last 2 hours. Whoever looked at Briggs's placement record after he arrived, that's your starting point." Mace looked at her for a moment. Then he turned to the nearest agent and said 3 quiet words, and the agent was on his radio. "Tab." The next hour moved in the layered, fractured way that high-stress situations always moved. Multiple things happening simultaneously, each one demanding attention, none of them willing to wait. Federal agents from a second vehicle had arrived and were moving through the building floor by floor, pulling staff IDs and cross-referencing against the access logs that IT was extracting under what Mace described as expedited authorization, and what the IT director, a rattled man named Ferraro, described as, "I don't think I can legally do this without a court order," until Tate showed him a document that apparently resolved the question. Claire positioned herself at the nursing station on the ICU floor. Not because anyone authorized her to. Her authorization to be anywhere in this building was currently somewhere in the gray zone between fired this morning and federal witness. But because she knew the floor's rhythms and the nurses working it didn't, and because Briggs was 12 feet away and she was not going to be in a different room until she understood exactly what the threat level was. The ICU charge nurse, a stocky man named Patrick Vega, who had been working this floor for 11 years and had the specific, unflappable manner of someone who had survived every variety of bad situation a hospital could generate, accepted her presence with a brief look and a nod that communicated both, "I have questions, and now is not the time for them." She appreciated that more than she could say. At 12:40, Priya appeared in the stairwell doorway. Claire crossed to her. "You're supposed to be on your floor." "Your floor is where things are happening." Priya's voice was steady, but her hands weren't quite. She was holding her tablet against her chest like a shield. "I pulled something. I don't know if it matters." "Tell me." "Holloway has a secondary administrator account. Most of the senior admin have them. Backup login, separate credentials, used for certain external reporting functions." She held out the tablet. "His secondary account accessed the veteran billing database at 6:53 this morning." Claire looked at the timestamp. 6:53. That's before my shift started. 40 minutes before the 9 o'clock meeting. Priya kept her voice low. He wasn't just restructuring the trauma team today. He was accessing records. Specifically, she swiped the screen, the records of 7 patients, all veterans, all admitted in the last 18 months. 3 of them were admitted, treated, and discharged with billing codes that don't match their documented procedures. Claire scrolled through the names. She didn't know any of them personally, but she recognized 2 of the admission dates. She'd been on shift both days, had passed through the trauma bay when those patients came in, and the billing codes on file bore no resemblance to what she remembered happening in that room. "He was pulling their records," Claire said, "sanitizing them before..." She stopped. Before what? Before Briggs arrived? He'd known Briggs was coming, which meant he'd known the federal attention was coming, or suspected it, and he'd been moving to clean the most exposed records before anyone could look too closely. "Priya," she handed the tablet back, "you need to give this to Agent Mace, right now. Don't stop to talk to anyone on the way. Don't leave it at a desk." "Where is he?" "Second floor, east corridor. Tell the agents at the stairwell you have information for Mace. They'll take you." Priya looked at her for a half-second longer than was comfortable, the look of someone who wanted to ask if this was going to be okay, and already knew the answer was, "I don't know." Then she went. Chum. The second escalation came from a direction Claire hadn't anticipated. Briggs's monitor alarmed at 1:17, not a catastrophic alarm, not the sustained flatline shriek that meant cardiac arrest, the specific rhythmic pattern that meant his heart rate was climbing faster than sedation should have allowed. She was at the window when it started, and inside the room 5 seconds later, Vega right behind her. The post-op sedation protocol for a splenic repair plus 2 GSW wounds had him on a specific medication combination. She'd checked the chart when she arrived, because of course she had. What was on the monitor now was a heart rate of 104 and trending up, which, for a man with his degree of blood loss and surgical trauma, was wrong. "Get Vargas up here," she told Vega, already at the bedside, already running her eyes over the IV lines, the medication drip, the monitoring leads. "Now." Vega was on the phone before she finished the sentence. She checked the drip first. The sedation medication bag was correct. Right medication, right concentration, labeled properly. But the rate on the pump was wrong. Not dramatically wrong, not wrong enough to trigger the pump's own alert system. Wrong by a calibration adjustment small enough to look like a setting error and large enough to reduce his effective sedation by roughly 30%. Someone had adjusted the pump, recently enough that the effect was only now showing in his vitals. "This pump was changed," she said. Vega came to look. He was quiet for a moment, then, "I checked those settings when he came up from OR. That's not what I set." "I know." She reset the rate herself, checked the other lines. The antibiotic drip was fine, the fluid maintenance was fine, and stood at the bedside while his heart rate slowly, over the next 4 minutes, came back down to the low 80s. She counted every beat. She did not look away from the monitor. Vargas arrived at 1:26, still in her surgical cap, and reviewed the pump record on the machine's internal log. The log showed a manual rate adjustment at 109. She pulled up the access credentials. The adjustment had been made with a nursing access code. "Whose code?" Claire asked. Vargas showed her the screen. The code belonged to a nurse named Drew Sallow, 28 years old, Redstone staff for 14 months. He was currently assigned to the ICU floor. He was not currently in the ICU. Vega checked the board. Sallow had logged a break at 1:05. He had not returned. Mace took the information about Sallow in the way he took most information, without visible reaction, like a man dropping something into a well and listening for the depth of it. He relayed it to his agents in under a minute, and the building search that had been methodical became urgent, and Claire watched the tempo of the whole operation shift upward from her position at the ICU station. Tate came to her at 1:40. He stood beside her at the nursing station and didn't say anything for a moment, which was the version of Tate that she was coming to understand meant the situation had developed in a way that required some management. "Sallow is connected to a staffing agency," he said finally. "The agency has placed personnel at 4 different medical facilities in this region over the last 3 years. All 4 facilities have veteran patient populations. All 4 have had some version of the funding irregularities we found here." He paused. "Redstone isn't the local node of something bigger. It's the model. Holloway developed it here, and someone used it as a template." She stared at the corridor. How many patients? Across all 4 facilities, the estimate is in the hundreds. He didn't soften it. She appreciated that. "And Sallow, placed at Redstone 8 weeks before Kowalczyk arrived, timed, we believe, to ensure someone was inside the ICU who could manage situations like today." Tate's jaw worked for a moment. "Someone planned for Briggs to end up here. The shooting, the ambulance routing, we think it was a setup. Not to bring him here for care, to bring him here to finish it, with an inside contact who could make it look like post-surgical complications." Claire felt the full weight of that land. "They were going to kill him in the ICU," she said. "We believe so. And if I hadn't been in the building, if Holloway's timing had worked, you wouldn't have been there to catch the pump adjustment. Vega might have caught it, or might not have until the vitals deteriorated further." He paused. "By which point, in a compromised patient post-major surgery, the outcome becomes much less predictable." She put her hands flat on the nursing station counter. The same thing she'd done in the conference room with Holloway, that morning, 100 years ago. She breathed. "Where is Sallow now?" she asked. "We don't know." She turned to look at him. "You don't know." "He's in the building. We've confirmed that much from badge access. He hasn't exited. But the building is large and we're working with limited personnel, and a floor-by-floor search takes time." "He has a reason to come back," she said. "He didn't finish what he came to do. Briggs is still alive." Tate looked at her steadily. "Yes. Then we need more people at this door." "We have more than 2. She said it without apology. "Get Mace to move agents from the lower floors. The exits are covered. Sallow isn't leaving. You said so yourself. So the threat isn't at the exits. It's here." Tate was already on his radio. The movement came at 2:15 from the service corridor behind the ICU. There was a supply route that connected the ICU to the central sterile processing department 2 floors below, a utilitarian passage used for equipment transport, rarely trafficked during clinical hours. Claire had known about it because she'd helped push equipment through it twice during busy overnight shifts in her first month at Redstone. It was not, she noted with the particular bitterness of retrospect, on the floor plan she'd seen any of the agents reviewing. She was the one who heard it. Vega heard it too, half a second later, a sound from the door at the end of the service corridor. The kind of sound a door makes when someone on the other side is trying to open it without making a sound, which is to say, exactly the sound you would make if you were moving quietly with purpose through a building you already knew. She was at the service corridor door before she'd consciously decided to move. She put her hand flat on it, felt the slight vibration of pressure from the other side, and stepped back and to the left, out of the direct line of the door's swing. "Agent," she said, clearly, in the direction of the nearest federal presence. One of Mace's plainclothes men who had materialized at the ICU entrance 12 minutes ago after Tate's radio call. Not loudly, just clearly. He was at the door in 4 seconds. He had his credentials in one hand and his other hand near his jacket in a way that was professionally neutral and unmistakable. The door opened. Drew Sallow was not what she'd expected, which was unfair of her because she had no reason to have expected anything specific. He was slight, maybe 170, brown hair, the kind of unmemorable face that was probably an asset in his line of work. He was wearing his Redstone scrubs and carrying a medication tray with the practiced ease of someone who had rehearsed the motion until it looked ordinary. He stopped when he saw the agent. He looked at the tray in his hands. He looked at Claire. She recognized the specific quality of calculation happening behind his eyes. Not panic, because panic was for people who hadn't thought through contingencies, and this was someone who had. He was running through options. "I was restocking," he said. His voice was even. "Put the tray down," the agent said. Put the tray on the floor and step back from the door." A pause of maybe 3 seconds, which in a narrow service corridor with a federal agent and a dismissed trauma nurse between him and his objective felt considerably longer. Then Sallow set the tray down. Claire looked at it from where she was standing. 4 items, 3 of which were standard ICU consumables, one of which was a syringe and a labeled sleeve that didn't match anything on Briggs's current medication protocol. "Don't touch the syringe," she said to the agent. He hadn't been going to, but he glanced at her, and she could see he'd clocked it. Sallow was detained in the service corridor with his hands behind him, and a second agent called from the east stairwell within 90 seconds. He didn't speak again after the initial exchange, which suggested either professional training or legal caution or both. And the absence of resistance was the kind of compliance that came from someone who had calculated that their position was fully compromised and was now managing for a different outcome further down the line. Claire stood in the corridor doorway and watched them take him and felt the particular hollow aftermath of a crisis that has resolved before it became fully catastrophic. The kind of feeling that wasn't relief exactly, because too much had already happened, and relief required more distance than she had. Mace appeared from the main floor 20 minutes later. He had the look of someone who had been running several simultaneous operations and was now receiving reports from all of them at once. He stopped in front of her, and for a moment neither of them said anything. "Sallow was carrying potassium chloride, Pamots," he said. "Concentrated, unlabeled. Delivered into an IV line in the right volume in a critically ill post-surgical patient. It presents as a cardiac event." He paused. "It is very difficult to detect an autopsy if you're not specifically looking for it." She had known it was something like that. Knowing it and hearing it said out loud were different. "Holloway," she said. "Do you have him?" Mace's expression shifted. "Not yet." "He's been gone 2 hours. We have agencies looking. His financial accounts are frozen. He has no passport. It was flagged at the start of the investigation 6 weeks ago." He said this with the flatness of someone who had made good decisions and was watching one of them not work out quite the way they'd planned. "He's still in the city. You don't know that. We're operating as though it's true." He looked at her directly. "Briggs is secure. Sallow is in custody. The building lockdown is holding. We have enough from the record access Priya Okafor flag to formally open the criminal case on the billing fraud." He paused. "You should rest." "I'm fine." "You've been fired this morning, identified as a material witness in a federal investigation, caught in ICU medication sabotage, and physically intercepted a suspect in a service corridor," Mace said, with no particular inflection on any of it. "You don't have to be fine." She didn't have a response to that, which was unusual. She went back to the ICU and stood at Briggs's window again. His vitals were stable, properly stable this time, the sedation running at the right rate, his color better than it had been in the OR prep area when she'd last seen him clearly. He looked, against all reasonable expectation given the morning he'd had, like a man who was going to make it. She put her hand flat on the cold glass. 8 months of disciplinary meetings. 8 months of Holloway's careful, administrative erosion. 8 months of being managed out by increments, and the whole time she'd thought it was about her methods, her pace, her combat medic habits that didn't translate cleanly to civilian protocols. It had never been about her habits. It had been about what her habits might lead her to see. She thought about the veteran patients in those records, the ones whose billing codes didn't match their treatments, the ones who had been discharged quickly, whose files were thin, who had no one pushing to review their charts, the ones who had come to this hospital injured and exhausted and trusting that the institution would take care of them, the same way they had trusted institutions for the better part of their adult lives, because that was what you did, because that was the arrangement. She thought about the Marine on Ashgrave who had told her, under fire, between the second and third extraction attempt, that he wasn't afraid, and she had known he was lying, and she had not said so because some lies are the thing keeping a person functional and you don't dismantle them under enemy fire. She thought about how she had left military service and come to a civilian hospital because she had believed in some inarticulate way that the work was the same work, keeping people alive, being the person in the room who did not panic, just in a different context. She had not been wrong about that. She had just not anticipated what the room would contain. Behind her, the elevator at the end of the corridor opened. She heard Mace's voice, sharp and sudden. "Where did he—" And then she heard Tate say a single word at a volume she had not heard from him all day. She turned. The monitor in Briggs's room began to alarm. She moved before she understood what she was moving toward. The monitor alarm in Briggs's room had the specific cadence of a rate alarm, not a flatline, his heart rate spiking, not stopping, but in the half-second between hearing Tate's voice and turning, she had already calculated that the spike was not physiological. His sedation was running correctly. His vitals had been stable, which meant something external had changed. She pushed through the ICU door. Vega was already inside, checking the lines. The room was intact. No one had entered. No medications had been touched. She looked at the monitor and saw it immediately. The rate alarm had been triggered by a movement artifact, Briggs's arm shifting against the bed rail, the electrode losing contact for 3 seconds. The machine had interpreted it as a spike. He was fine. She put her hand on his wrist and counted, old habit, even with the monitor right there. Pulse steady, 74. She exhaled. "Clear," she called to Vega. Then she went back to the corridor to find out what Tate had said and why. Grant Holloway had been found in the basement, not in some dramatic fashion, not cornered, not fleeing. He'd been sitting in the record storage room on sublevel 2, in the dark, in a chair he'd pulled from behind a filing cabinet, with his jacket folded across his knees and his hands in his lap. One of the agents doing the floor sweep had found him when she pushed the door open. He had looked up at the light from the corridor and said, with a flatness that suggested the adrenaline of whatever plan he'd had was fully exhausted, "I'd like to speak with legal counsel." By the time Claire got downstairs with Mace, Holloway was in the corridor outside the records room with 2 agents and a look on his face that she had not seen from him before, the absence of the administrative authority that had always been his primary expression. Without it, he looked older than she remembered, and smaller in a way that had nothing to do with physical size. He saw her. Something moved across his face. Not guilt exactly, nothing that clean. More like the expression of a man recalculating, recognizing that the variables were not what he'd arranged them to be. "Bennett," he said. She looked at him. She did not say anything. "I want you to know," he started. "Mr. Holloway." Mace's voice was neither harsh nor gentle. It was the voice of a process already in motion. "You've asked for legal counsel. I'd encourage you to wait for that before speaking." Holloway closed his mouth. Claire turned away. She had thought at some point during the morning that seeing him caught would feel like something specific, like resolution or validation or the particular satisfaction of a corrected wrong. It didn't feel like that. It felt like the end of a very long shift where she was tired and her feet hurt, and the work wasn't done yet. And what she mostly felt was the absence of the threat rather than the presence of justice. Justice was a longer process. She had been in enough rooms to know that. What she felt, standing in the basement corridor of a hospital she'd been fired from 6 hours ago, was the need to go back upstairs and check on her patient. The formal arrest happened at 3:47, not in a dramatic corridor confrontation with staff watching. Mace and the legal office had worked that particular logistics problem carefully, moving Holloway from the basement to a secured vehicle through the service entrance while most of the clinical staff were managing the tail end of the building lockdown and the administrative chaos that came with it. The announcement to hospital staff came from the interim administrator, a woman named Dr. Yolanda Ferris, who had been reached by the Federal Oversight Office and who arrived at Redstone at 3:15 with the barely contained expression of someone who had received a phone call that restructured her entire afternoon. Ferris was 61, had 30 years in hospital administration, and had the specific competence of a person who had cleaned up other people's messes before and did not enjoy it but was very good at it. She convened a department head meeting at 4 o'clock in the main conference room, and when she came out 40 minutes later, her expression had settled into the particular set of someone who had heard things that were worse than she'd anticipated, but not so much worse that she'd lost her footing. She found Claire at the ICU nursing station. "You're Bennett," Ferris said. Not a question. "Yes. You were terminated this morning." "That's what I was told." Ferris looked at her for a moment with the assessing gaze of someone reading a file in real time. "Your termination is being reviewed. Given the circumstances, that's something of an understatement. We'll be reviewing a number of personnel decisions made in the last several months." She paused. "In the meantime, I understand you've been operating in a functional capacity in this unit for most of the day." "I've been present. The federal agents cleared it." "I'm not objecting." Ferris's voice had no warmth in it, but it had a kind of directness that Claire found, after a day of managed communications and strategic pauses, genuinely refreshing. "I'm informing you that as of right now, your access has been reinstated on a provisional basis. You're not on the schedule, and I'm not asking you to take a patient assignment, but if you choose to remain in this building, you're not doing so without authorization." "Thank you." Ferris started to turn, then stopped. "The patient in room 4, Briggs." She said his name carefully, like she was aware of its weight. "What's his prognosis?" "Vargas would give you the official assessment, but if you're asking me," Claire looked through the window at the room, "he's going to make it. He's a strong recovery candidate. The surgical repair was clean, and if he stays infection-free for the next 72 hours, he's looking at a long rehabilitation, but a full one." Ferris nodded once. Then she left. At 5 o'clock, the lockdown was partially lifted. Staff could move between floors. Visitors with prior authorization were being processed. Non-critical patient transfers were resuming. The building had the wrung-out, slightly disoriented quality of any institution that has been through something it didn't anticipate and is now attempting to reestablish the rhythms of normalcy. It didn't quite work because normality had a foundation, and Redstone's foundation had spent the last 4 years being quietly hollowed out. Priya found Claire in the break room at 5:15, eating half a sandwich she'd gotten from the vending machine because it was the first thing she'd put in her body since the burnt plastic coffee at 6:48 that morning. Priya sat down across from her and for a moment just looked at her with the expression of someone who has been through an adjacent experience and needs to establish that the other person is intact before saying anything else. "You okay?" Priya asked. "Mostly." Claire ate another bite. The sandwich was some variety of turkey and cheese and was completely inoffensive, which at this point in the day felt like a significant achievement. "You?" "I keep thinking about the records I pulled." Priya had her hands wrapped around a coffee cup she wasn't drinking from. "Those patient names. The billing codes. I've been here for 6 years and I walk past those files every shift and I didn't see it." "You weren't looking for it." "Neither were you, technically." "No." Claire looked at the table. "But I had reason to look at individual charts closely. The way I worked, spending time with patients, following up on things that didn't look right clinically, it was getting me close to the discrepancies by accident. Holloway didn't know specifically what I'd seen. He just knew the way I worked was a risk. So they targeted you. They managed me. They were careful about it. Disciplinary process, documentation, keeping it looking legitimate. If Briggs hadn't come in today, in 3 more months, I'd probably have been out on a formal performance basis with a paper trail that made it look completely reasonable." She finished the sandwich. "And they'd have kept going." Priya was quiet for a moment. "The other hospitals," she said. "The other facilities the staffing agency placed people in. Mace's office is handling it. Multiple federal agencies, from what I understand. It's..." Claire paused, finding the word significant. How many patients? I don't have the full number. Neither of them said anything for a moment. The break room hummed with its refrigerator and its overhead light, and the distant sounds of a hospital trying to resume being a hospital. Claire, Priya set down the coffee cup. When they reinstate you, and they will, you know Kowalczyk is still here. She had thought about Kowalczyk. He was the problem that didn't resolve cleanly with Holloway's arrest, because his role was more clinical and less financial, more about restructuring and obstruction than direct fraud. He had recommended her removal. He had been brought in to manage the exposure. Whether that crossed into criminal territory was going to depend on what the investigators found in his communications and his contract with the hospital. That's not my decision to make, she said. You could push for it. Mace's office is already looking at him. Whatever they find, they'll act on. She stood up, gathered the sandwich wrapper. If I start making decisions based on what I want for myself, I stop being useful. And right now, being useful is the only thing I know how to do with any of this. Priya looked at her for a long moment. Does it ever exhaust you, being like that? Claire almost smiled. Constantly. The development that changed the shape of the investigation came at 6:20 from a direction that none of them had been looking. Mace's team had been working through the financial trail of the veteran billing fraud, the shell accounts, the intermediary transfers, the falsified reimbursement claims, and the picture they'd been building was of a relatively contained operation. Significant, criminal, worth prosecuting, but bounded. Redstone was the model, 4 facilities were the scope, Holloway was the architect. Then the forensic accountant working the case flagged something in the shell company structure that didn't fit that picture. Mace came to the ICU floor at 6:20 with a printed document in his hand, which was the first time she'd seen him carry anything physical, and he had the look of someone who has opened a door expecting one room and found a corridor. He sat down beside her at the nursing station. He put the document on the counter. He didn't speak for a moment. The shell company Sallow used to receive payments, he said finally. We traced it back through 3 layers of incorporation. At the 3rd layer, it connects to a defense consulting firm with federal contractor status. He paused. That firm has contracts with the Department of Defense, specifically with units involved in Joint Special Operations logistics. She stared at the document. The same operations. We don't know the extent yet, but the firm appears on financial disclosures connected to several classified operations in the relevant region and time period. He tapped the paper, including the period of Operation Ashgrave. The nursing station was very quiet. Someone used the veteran billing fraud as a funding mechanism, she said slowly. They weren't just stealing money. They were moving money through a mechanism that looked like healthcare fraud but was actually funding something we haven't fully identified yet. Yes, Mace's voice was careful. The healthcare fraud was real and prosecutable on its own merits, but it may also have been a laundry operation. The veterans were the cover, not just the victims. She sat with that for a long moment. The implications of it were the kind that didn't resolve into clean outrage because the scale kept expanding every time she tried to look at the edges of it. Briggs knew, she said. That's why he was targeted. We believe he came across information during his last deployment that connected the logistics firm to the operations. He was trying to get it to the right people, and someone moved to stop him before he could. Mace folded the document. The shooting wasn't random, and it wasn't just about silencing a witness to the healthcare fraud. It was about protecting something much larger. And Holloway? We believe he was a local contractor. He set up the mechanism, ran it locally, received payments. He may not have fully understood what the money was ultimately for, or he understood enough and chose not to ask. A pause. Neither option is exculpatory. What about the people above him, the ones running the defense firm? That, Mace said, is the investigation that's now beginning. What happened here today, Sallow's arrest, the records Priya pulled, the financial trail, gives us enough to open a federal case that goes considerably higher than this hospital. He looked at her. It's going to take time, months, probably longer. But it's open. It's open. She looked through the window at Briggs, still sedated, still breathing steadily, monitors showing the unremarkable constancy of a man doing the difficult work of staying alive. He had come here in a planned trap, and survived it because of a confluence of factors. None of the people who planned it had accounted for. The wrong ambulance routing, a fired nurse who didn't leave the building, a pump adjustment that got caught in time. Contingency, she thought, the word they used in the army for the thing that didn't go according to plan. Every operation had contingency. The question was always whose contingency held. At 7 o'clock, Kowalczyk appeared at the ICU entrance. He was not in scrubs. He was in his civilian coat, which meant he was leaving, and he was moving with the specific purposefulness of someone who had made a decision and was executing it before the decision could be reconsidered. He had his bag over his shoulder and his ID badge in his hand. About to return it, the universal body language of someone who is departing on their own terms before being asked to depart on someone else's. He saw Claire at the nursing station. He stopped. She watched him work through his options in real time. The same calculation she'd seen in Sallow's face in the service corridor, just wearing a different kind of professional composure. He looked at the agents she could see and the agents he couldn't, and he looked at his badge in his hand, and then he looked at her. "I want you to know," he said from the doorway, "that my involvement was limited." She looked at him steadily. "Was it?" "I was hired to restructure the department. The staffing decisions. You were hired to remove experienced nurses who might notice the billing discrepancies," she said. Not harshly, just accurately. "You knew why you were doing it." His jaw moved. "I followed administrative directives." "So did a lot of people in history," she said. "It was also the defense they used." The agent nearest the door had stepped forward by half a step during this exchange, which was enough. Kowalczyk looked at him. He looked at Claire once more, something in his face that might have been the beginning of several different things, and then he said quietly, "I'd like to speak with someone from legal." "I'm sure that can be arranged," the agent said. He was not leaving on his own terms. By 8:30, the hospital had the strange post-crisis quality of somewhere that has been through a storm and is assessing damage in the particular confused light of after. Staff were comparing versions of events, not all of which were accurate. 3 nurses had been interviewed by investigators. The pharmacy had been audited. The financial records for the past 18 months were in the possession of federal auditors who had set up in the administrative wing with a request for nobody to enter without clearance. Ferris moved through it all with the grim efficiency of a person rebuilding a foundation while standing on it. She made decisions quickly, communicated them clearly, and did not appear to be especially interested in the political dimensions of what had happened, which was either her genuine inclination or a very practiced mask, and at this point, Claire wasn't sure it mattered which. At 9 o'clock, Briggs began to come out of sedation. It was gradual. Sedation lift on a post-surgical patient always was. The anesthetics clearing at their own pace, the patient moving through layers of consciousness that looked from the outside like restlessness, like pain, like confusion, and sometimes like all 3 at once. Vargas was there for the first 30 minutes, managing the weaning protocol, adjusting parameters, doing the precise and careful work of bringing a person back from the chemical distance surgery required. Claire stood outside the room. She had been told, politely, that she was not needed in the room during the wake process. Vargas's team was capable and attentive, and the situation was managed. She knew all of this. She stood outside this room anyway, because it was where she needed to be, and because sometimes needing a thing is sufficient justification, even when it doesn't fit any formal protocol. Through the window, she watched Briggs' face change as consciousness returned, the small movements, the brief tension in the muscles around his eyes, the hand that shifted against the sheet and then stopped. He was fighting something in the near distance, some residual processing from the sedation, the way people sometimes did when the brain started resuming its full operations and encountered the gap between where it had been and where it found itself now. Then his eyes opened. He looked at the ceiling, he looked at the monitor. He looked at Vargas, who said something to him with the careful, measured delivery of a physician orienting a post-surgical patient. His expression moved through a sequence she couldn't fully read through the glass: pain, recognition, something more complicated. And then his eyes moved to the window. He found her immediately. Like she was the reference point he'd been looking for. She stayed where she was. She didn't wave. She didn't perform anything. She just let herself be visible, because that was what he needed. the confirmation that someone he recognized was on the other side of the glass, and the situation had not fully collapsed. His mouth moved. She couldn't hear him through the window. She lip-read 2 words. "You stayed." She nodded once. One full, honest nod. He closed his eyes again. Not in distress, in something that looked, despite everything, like a man setting down something very heavy he'd been carrying for a long time. "Cool." Mace found her at this window at 9:40. "Holloway is formally charged," he said. "Federal charges. Wire fraud, theft of federal funds, obstruction of a federal investigation. The DA's office is looking at additional state charges." He stood beside her, looking into the room. "Kowalczyk is cooperating. He's providing information on the contracting firm in exchange for consideration. We'll see how useful it is." "Sallow?" "Held without bail. The potassium chloride gives us attempted murder on top of the conspiracy charges. His attorney arrived an hour ago." A pause. "The paramedic who made the call from the ambulance bay is also cooperating. He says he was told it would be a routine notification, that someone needed to know Briggs had survived the shooting. He claims he didn't know what would happen at the hospital." "Do you believe him?" "I believe he's saying it." Mace's voice was neutral. "What's true is for the process to determine." She thought about the paramedic. Young, probably, following a phone call that had been framed as something minor, not understanding that minor actions in systems like this were how the larger machinery operated. Not innocent, necessarily, but not the architect either. The system had a way of using people like that. People at the edge of the operation who were useful precisely because they could claim they didn't know what the center looked like. "The defense firm," she said. "Active investigation. I can't tell you much, but the people who need to know about it know about it." He paused. "Briggs's testimony, when he's able, will be significant. He's going to need protection for the foreseeable future." "I know. We're arranging that." She looked at Briggs through the window. Vargas's team was adjusting his positioning, moving him to a more comfortable post-sedation posture, and he was cooperating with the movement in the limited way of someone whose body has decided that fighting anything right now is not worth the cost. "Mace!" She kept her eyes on the room. "When this started, 6 weeks ago, when you began looking at Holloway, why didn't you alert the hospital? Why let it continue?" He was quiet for a moment. "We needed to follow the financial trail without alerting the people at the end of it. If we moved on Holloway immediately, the shell structure would have been dismantled before we could trace where the money went. So the veterans whose records were being falsified were part of an active situation we were trying to resolve as quickly as we responsibly could." His voice didn't quite harden, but it didn't soften either. "I understand that's not satisfying. It shouldn't be. The timeline costs people something." She turned to look at him. "Say that again someday, to their faces." He met her eyes. "If the case goes where I expect it to, I'll have to." It wasn't an apology. It was something more difficult, an acknowledgement with no resolution attached to it. She respected it more than she would have respected the apology. The hour between 10 and 11 was the quietest of the day. The federal personnel had moved most of their operations to the administrative wing. The ICU floor had returned to its clinical rhythms. Vega running the station, the nursing team doing their careful routine work, the machinery of serious illness management proceeding with the institutional steadiness that characterized intensive care at its functional best. Claire sat in the family consultation room, the one with the beach painting, and for the first time since 6:48 that morning, did nothing. She didn't think about the case. She didn't think about Holloway, or Kowalczyk, or Sallow, or the defense firm, or the financial trail, or the 4 other hospitals, or the patients whose records had been cleaned. She sat in the chair and looked at the beach painting and noticed that the waves were painted slightly incorrectly, the foam at the crest too uniform, the perspective off in a small but definite way, and thought about that instead for approximately 3 minutes. Then she took out her phone and called her mother. Her mother, who was 63 and lived in a smaller city 4 hours south, and had never fully understood what Claire had done in the army or why it had taken her so long to come home after, answered on the second ring with the specific cadence of a woman who had been expecting a call for hours. "I heard you had a day," her mother said. "You couldn't have heard anything. It's not public yet." "Priya called me." Claire closed her eyes briefly. "Of course she did. Are you hurt?" No. Are you okay? She thought about the honest answer to that question, which was complicated and would take longer than this call to communicate accurately. I'm standing, she said. That's not what I asked. I know. She looked at the painting. I'll come down this weekend if things settle. I'll tell you then. Her mother was quiet for a moment, not the quiet of dissatisfaction, but the quiet of a person who has learned when to wait. The young man you helped, she said. Is he going to be all right? Yes, Claire said. He's going to be all right. After she hung up, she sat for another few minutes in the quiet. Outside the consultation room, she could hear the hospital settling into its nighttime rhythms. Slightly slower, slightly dimmer, the daytime chaos traded for the particular vigilance of overnight medicine. She stood up. She went back to the ICU. Briggs was awake. Not groggy awake, not in and out, genuinely awake, tracking the room with the alert, accustomed wariness of someone whose body had spent years in situations that required continuous environmental awareness and hadn't fully switched it off despite the surgical drains and the IV lines and the hospital bed. Vargas had cleared him for brief, low-stimulation contact. One of Mace's agents was in the room. Tate was in the corridor. Claire pushed the door open. Briggs looked at her. His voice, when it came, was the rough, abraded voice of a man who'd had a tube down his throat and wasn't fully over it. They told me, he said, what you did. Which part? All of it. A pause. The pump. Vega and I both caught it. You caught it. He held her gaze. Don't do that thing where you distribute the credit. She pulled the chair beside his bed and sat down because standing was going to be awkward for the length of this conversation. How are you feeling? Like someone took a spleen out of me. He shifted slightly against the pillow, and the movement cost him something she could see in his face, but that he did not verbalize. The agents debriefed me for about 20 minutes before Vargas threw them out. Was that enough? Enough to open what needs to be opened. His eyes were steady, tired but steady. They tell me they've got the firm now, the financial trail. Mace's team is working it. It's bigger than Redstone, Briggs said. It wasn't a question. I know. He looked at the window, the corridor outside, the movement of the ICU floor visible through it. When they shot me, he said, I thought the calculation they'd made was that I was the only link, that if I didn't make it, the information died with me. A pause. I didn't know about the hospital piece. I didn't know Redstone was part of it. I came here. He stopped, the sentence catching somewhere. You ended up here because they planned it, she said. The routing. You were supposed to come here and not make it out of surgery. I know that now. He was quiet for a moment. You weren't supposed to be here either. No. She looked at him. Holloway had me out the door by 9. Something moved in his expression, not quite a smile, but the recognition of a thing that was almost too specific to be accidental. Contingency, he said. Contingency, she agreed. They sat with that for a moment. The monitors registered his heartbeat in its steady, unremarkable rhythm, and through the window the ICU floor continued its nighttime operations. And somewhere in the administrative wing, federal auditors were working through financial records that were going to take months to fully map. And Holloway was in a federal detention facility answering questions he had spent 6 weeks hoping he'd never be asked. I owe you, Briggs said. You don't. She said it without softening it. You already paid it. A long time ago. He looked at her. The question behind his eyes, the specific one about Ashgrave and about what she remembered and about all the things that had never been said between the people who'd been through that particular 47 hours together. And she met it steadily, and neither of them said the things that didn't need to be said. Get some sleep, she told him. You've got a long recovery, and I'll be checking your chart. So you're back. Provisionally. She stood. Go to sleep, Sergeant. You were a better medic than nurse, he said. I was a great nurse, she said. You just don't know enough nurses. She was almost to the door when he said quietly, Bennett. She turned. I need you to know, the people above the firm, above the contracts. His voice had changed, the tiredness pulling back enough to let something more serious through. Mace doesn't have all of it yet. There's a component he doesn't know about, something I didn't get to tell them before Vargas ended the debrief. His eyes were very steady. The firm wasn't just running money. They were running information, classified operational data, sold to... He stopped. The monitor beeped. Tate was in the doorway. Sergeant Briggs, Tate said, the debrief continues tomorrow. Doctor's orders. Briggs looked at Claire. She looked at him. Sold to, he had said. Sold to. And then Tate had appeared in the doorway, and the sentence had stopped, and whatever Briggs knew, whatever information he'd been carrying that was so dangerous that someone had shot him and routed him to a hospital with an inside contact and adjusted his medication pump, was still only half out of him, and the half that remained was the part that apparently changed everything else. She walked back out into the corridor. Tate pulled the door closed. She stood very still for a moment, the ICU floor moving around her in its steady nighttime rhythm, and she thought about the word sold, and about the defense firm, and about the classified operational data, and about the fact that Mace's entire investigation, the federal case he'd described as opening tonight, the charges against Holloway, the cooperation from Kowalczyk, the financial trail that had taken 6 weeks to build, might be the frame around a painting they hadn't actually seen yet. She thought about the look on Briggs's face when Tate appeared. He hadn't looked relieved by the interruption. He had looked like someone who understood that there were people in the room who should not hear what he was about to say, and was no longer certain which kind of person Tate was. She didn't sleep that night. Not because she couldn't. Her body was running on 14 hours of sustained adrenaline and 2 cups of bad coffee and half a vending machine sandwich, and somewhere around midnight it began sending signals that were less requests and more demands. She ignored them. She sat in the family consultation room with the beach painting and the box of tissues and thought about the word sold, and about Tate standing in the doorway at exactly the moment Briggs reached the part that mattered, and about the specific quality of Briggs's silence after. She was not accusing Tate of anything. She was not certain of anything. What she was certain of was that Briggs had stopped talking when Tate appeared, and that Briggs was a man who had survived classified operations and a targeted shooting and an ICU medication sabotage by making correct reads of situations very quickly, and that his instincts were not the kind she was going to dismiss. At 12:40, she went back to the ICU. Vega was still on. He'd pulled a double without being asked, which told her something about who he was. And Briggs was sleeping, genuinely sleeping now, the deep healing unconsciousness that the body enforces after major trauma when it finally gets the chance. She stood at his window for a few minutes, confirmed what the monitors confirmed, and left him to it. Then she went to find Mace, Pachi. He was in the administrative wing in what had been Holloway's outer office, surrounded by printed documents and 2 agents working laptops and the general controlled disorder of an investigation that had exceeded its original scope. He looked up when she came in. He looked like someone who had also not slept, but who was managing it better because he'd had more practice. Bennett, Briggs started to tell me something tonight, she said. She sat down across from him without being invited, which at this point in the day felt like a formality that had lapsed. About the defense firm. He said they weren't just running money, they were running information, classified operational data. Sold to... And then he stopped. Mace looked at her. Tate came in, she said. The room was very quiet. The 2 agents at the laptops had not visibly reacted, which itself was a kind of reaction. Mace held her gaze for a long moment. Something moved through his expression that was not readable exactly, but had the quality of a man reaching a decision rather than a conclusion. He looked at the agents on the laptops and said, "Give us the room." They left without hesitation or question. He waited until the door closed. "How certain are you that he stopped because of Tate specifically?" "I'm not certain. I'm telling you what I observed." Briggs has been through significant trauma, post-surgical, post-sedation, in pain. His read of the situation was probably sharper than yours or mine, yes, she said. I've operated alongside people in his operational category. Their situational awareness doesn't go offline when they're injured. It gets narrower, more focused, more accurate, not less. Mace leaned back in his chair. He looked at the ceiling for a moment, which was the most unguarded thing she'd seen him do all day. Tate has been with this office for 11 years, he said. I'm sure he has. What you're suggesting, I'm not suggesting anything. I'm telling you what Briggs's body language communicated and asking you to take it seriously. She leaned forward. What does your office know about the classified operational data component? Before tonight, before what Briggs started to say, did that angle exist in your investigation? A pause. No, Mace said. Then it's new information. And the only person in that room when Briggs started to share it, besides me, was Tate. Mace was quiet for a very long time. The kind of quiet that wasn't thinking. It was the quietness of a person who has already passed thinking and into the harder territory of deciding. I need you to go back to the ICU, he said finally. Stay with Briggs. Don't let anyone into that room who isn't Vargas or Vega or one of the two agents I'm about to designate. He reached for his phone. And don't tell anyone I'm making those calls. She stood. What are you going to do? Something I should have done 6 weeks ago, he said. Run a parallel check on everyone in this operation, including the people I trust. He looked at her. Including myself, technically, though the logistics of that are awkward. She left him to it. The night passed the way difficult nights pass, slowly, unevenly, with long stretches of stillness punctuated by small urgencies. One of Briggs's drainage lines needed attention at 2:15. Vega handled it cleanly. His blood pressure dipped briefly at 340, recovered on its own within 7 minutes, Vargas notified and monitoring remotely. Claire sat in the chair outside his room and watched the corridor and drank water from the nursing station and did not think about Tate, because thinking about it would not accelerate Mace's process and would consume energy she needed for other things. At 4:30, Mace appeared in the ICU corridor. He had with him 2 agents she had not seen before, not from the original team, not people who had been in the building during the day. They were introduced to her by badge number rather than name, which was either procedural or deliberate, and she didn't ask which. Mace spoke briefly to Vega, showed him something on his phone, and then came to stand beside her. Tate is being separated from the investigation, he said quietly. Pending a review I've initiated through a separate channel. He's not under arrest. He's not formally accused of anything, but he's been removed from access. What did you find? Enough to justify the removal. Not enough yet to tell you more. He looked toward Briggs's room. His debrief resumes at 6. I'll be running it personally with the 2 agents you just met. No one else in the room? She nodded. You can be present, Mace said, if Briggs requests it. He will, she said, with the confidence of someone who has earned enough of a person's trust to make predictions about it. She was right. When Vargas cleared Briggs for the debrief at 6:10 and Mace asked him who he wanted present, Briggs looked at Claire through the window and said, Her. The debrief lasted 2 hours and 40 minutes. Claire sat in the corner and did not speak, and did not ask questions, and did not react visibly to anything that was said, because those were the terms Mace had established, and they were reasonable terms, and she honored them. She was there as an anchor, not a participant, the familiar face in the room that allowed Briggs to speak without monitoring every person present for threat. What Briggs told them was this. The defense consulting firm, Radmore Strategic Group, which was not a name any of them had used until now, had been operating for 9 years. In its early years, it was a legitimate contractor, procurement logistics for special operations units, the kind of mid-level defense work that was unremarkable and legal and boring. Then, approximately 6 years ago, its primary client base shifted. The procurement work became a cover. The actual business became brokering, operational information, troop movements, mission parameters, asset identities, all of it classified, all of it sold. The buyers were not a single entity. They were a network, some foreign, some domestic, some existing in the specific gray zone of private interest that operated across borders. Radmore didn't care about ideology. They cared about price. The veteran healthcare fraud at Redstone and the 4 other facilities was, as Mace had suspected, a money laundering mechanism. But it was also something else. Holloway's operation had given Radmore access to veteran patient records, including service histories, which could be cross-referenced against classified personnel databases to identify active and recently separated special operations personnel. People who might have operational knowledge worth acquiring. People who might be vulnerabilities. Briggs had discovered this not through official channels, but through a former colleague, a woman who had worked briefly in Radmore's procurement division before understanding what the company actually was, and who had died 14 months ago in what was ruled an accidental drowning. He had spent the subsequent 14 months building a documentation trail. Quietly. Outside of official channels, because he didn't know which official channels were safe. He had been trying to identify a federal contact he could trust when the shooting happened. He had been 3 days from making contact with Mace's office. When Briggs finished, the room was quiet for a moment. Then Mace said, "The documentation." "Encrypted drive," Briggs said. "External. Not here." "Location." Briggs looked at Claire once, just once, briefly, the look of a man who has kept something for a very long time and is making the final decision to let go of it. Then he gave Mace the location. Mum. The encrypted drive was retrieved by 9 a.m. Claire knew this because Mace told her, which meant he'd decided she was inside the perimeter of people who needed to know things. She wasn't sure exactly when that decision had been made, but she accepted it with the same practical efficiency with which she accepted most things. What was on the drive expanded the investigation from a federal healthcare fraud case into something that involved 4 separate agencies and a coordination call with people Mace spoke to in a room he entered alone and exited from looking like a man who had confirmed something he'd hoped was wrong. He didn't tell her the full contents. He told her enough. Radmore's strategic group was finished. The principals, 7 of them, distributed across 3 cities, were taken into custody over the following 36 hours. The operations were quiet, coordinated, and did not appear in any public reporting for 2 weeks, at which point a brief federal statement acknowledged that an investigation into defense contractor fraud and unauthorized disclosure of classified information had resulted in multiple arrests. The statement was 4 sentences long. It answered none of the questions a reporter would have asked. Tate was not among those arrested. His removal from the investigation had been precautionary, and the review Mace initiated found evidence of compromised communications rather than active participation. Someone had accessed his credentials without his knowledge, using his access codes to monitor the investigation's progress in real time. He was cleared of complicity, though the process of that clearing was slow and uncomfortable and left marks. The agents who had replaced him remained on the case. The person who had used Tate's credentials was a Radmore associate who had been embedded in the federal contracting system for 3 years. She was arrested in the second wave of detentions, in a city 600 miles from Ashford, on a Tuesday morning while she was doing something as ordinary as buying coffee. Because that was how these things usually ended, not in dramatic confrontation, but in the mundane interruption of a normal moment by people with warrants and credentials. The consequences for Redstone and its people were slower and more public than the Radmore arrests, and in some ways more satisfying, because they happened in the institution itself, and the people who had worked there could see them. Grant Holloway was formally indicted on 11 federal counts: wire fraud, theft of federal program funds, obstruction of a federal investigation, conspiracy, and falsification of medical records. The state AG's office added 4 state charges, including Medicaid fraud. He entered a not guilty plea that his attorney delivered on his behalf, and he was released on a bail figure that required him to surrender his passport and wear an ankle monitor and remain within county limits. His medical administrator's license was suspended by the state licensing board within 2 weeks of his arrest, pending the criminal proceedings. The suspension was automatic under the applicable statutes, which meant no hearing, no appeal delay, just a letter and a status change in the database. He had been an administrator for 22 years. The license suspension erased the credential that had defined that entire span of his professional life before a single court date had been set. His assets were frozen pending the fraud investigation. The house in the better neighborhood across town, the investment accounts, the vehicle. All of it held in place while forensic accountants worked through the records, tracing the money that had moved through shell accounts and ended up somewhere it shouldn't have. Richard Kowalczyk's cooperation agreement reduced his exposure significantly, which was the nature of cooperation agreements, and which was imperfect and known to be imperfect by everyone involved. He provided testimony about Radmore's recruitment of Holloway, about the staffing agency's placement process, about the specific instructions he'd been given regarding which personnel to remove from which positions. His medical license was not suspended. He had not directly participated in the billing fraud, but he was barred from administrative roles in any federally funded healthcare facility for 10 years, a restriction that effectively ended the trajectory he'd been building. He relocated. Nobody from Redstone heard from him again. Drew Sallow pled guilty to attempted murder and conspiracy charges. He received a 17-year sentence, the high end of the guideline range, which the judge noted was appropriate given the deliberate targeting of an already critically ill patient in a medical facility. The judge said a few other things at sentencing that were more pointed and less procedural in tone, the kind of language judges use when they want the record to reflect something beyond the statutory calculus. The courtroom was not empty when she said them. The paramedic who had made the call from the ambulance bay, his name was Marcus Osei, 24 years old, 2 years on the job, pled guilty to a lesser charge and received 18 months of supervised release and a permanent bar from emergency medical services. He had followed an instruction without understanding its full consequence, which was true, and which was also not sufficient to exempt him from what the instruction had been part of. Both things could be true. They were. The 4 other healthcare facilities connected to Radmore's operation were investigated individually. Patient records were audited across all 4 sites. A restitution fund was established through the federal settlement process to compensate veterans whose claims had been fraudulently processed. The fund was not large enough. It never was. But it existed, which was the difference between an injustice acknowledged and one buried. And that difference mattered to the people who received the letters in the mail, telling them that what had happened to them had been seen. Redstone Memorial Medical Center operated under federal oversight for 8 months following Holloway's arrest. Ferris ran it during that period with the particular grim competence of someone who understood that an institution's reputation was not a thing that returned quickly and could not be forced and could only be slowly rebuilt through the accumulation of decisions that were made correctly when there was no one watching to reward them. The trauma department was restructured, genuinely this time, with clinical input from the nurses and physicians who worked in it. The billing processes were rebuilt with an independent audit mechanism. The veteran patient program was redesigned with an external advocacy board that had actual authority to flag discrepancies, not just the advisory function that had been an institutional suggestion box for years. Priya Okafor was promoted to charge nurse of the emergency department. She accepted the position with the particular reluctance of someone who would have preferred that it had come through a less catastrophic route and who was good enough at the job to make something of it anyway. Patrick Vega received a formal commendation from the hospital board for his conduct during the lockdown. He put it in a drawer and went back to running his floor. Claire's termination was formally rescinded on the 8th day after Holloway's arrest, with a letter from the Oversight Authority that used the phrase "without cause" and under improper circumstances in its first paragraph and outlined the reinstatement terms in clear, unambiguous language. She read the letter once, folded it, and put it in the bag she carried to work. She had already been back on shift for 3 days by the time the letter arrived, working under Ferris's provisional authorization while the paperwork moved through the process at the pace institutional paperwork moves. Nobody had told her to wait. She had not waited. Briggs was discharged from Redstone 22 days after his surgery. His recovery had not been smooth. An infection in the second week that set him back 4 days, a secondary complication with one of the surgical repairs that required a procedure Vargas described as straightforward and that Briggs described with considerably less diplomatic language while coming out of the local anesthetic. He was a difficult patient in the specific way that people who are accustomed to pushing through physical adversity are difficult patients. He wanted to do more than his body had authorized, and the negotiation between what he intended and what was possible was a daily friction that his nurses managed with varying degrees of patience. Claire managed it with none, which he seemed to appreciate more than patience would have earned her. "You're not walking to the end of the hall today," she told him on day 14. When he was attempting to disconnect his own monitoring leads with the quiet determination of someone who believed that if they did it slowly enough, no one would notice. "I walked to the end of the hall yesterday." "You walked 12 feet and then sat down in the chair by the window for 40 minutes because you were exhausted. That was a choice." "It was your body making a choice for you," she said. "There's a difference. Reconnect the leads." He looked at her. "You know I outrank you." "You're not in the army anymore, Sergeant. In here, I outrank you. She held out the monitoring lead. Reconnect. He took it. He reconnected it. He did not look happy about it, which was fine. She wasn't there to be liked. The morning he was discharged, she came to the room to find him already dressed, sitting on the edge of the bed in civilian clothes that someone had brought for him, jeans, a gray shirt, boots that he'd managed to put on despite the still limited range of motion in his left side. He looked like himself, or a version of himself that had been through something and was carrying the evidence of it but was not diminished by it. Mace was there, two of the agents, a woman from the Federal Protection Detail who would be accompanying Briggs for the foreseeable future, a compact, watchful person named Specialist Reyes, who said very little and positioned herself in rooms the way people do when they are always accounting for exit routes. Claire did the final discharge check, vitals, wound sites, medication instructions, follow-up appointments. She went through all of it with the same focused attention she brought to every patient, the same thoroughness that had never varied regardless of whether anyone was watching or whether she'd been fired that morning, or whether the person in the bed was someone she'd pulled back from the edge of a very specifically designed death. When she finished, she handed him the discharge folder. He took it. He looked at it for a moment. Then he looked at her. I've been trying to figure out what to say, he said, for about a week. You don't have to say anything. I know. He held the folder. That's not why I'm saying it. He paused. On Ashgrave, when you stayed, when the extraction point was compromised and everyone else was moving and you stayed. I've thought about that a lot of times since, in a lot of different situations. He stopped again, the way people stop when they've reached the part of a thing that doesn't translate cleanly into language. I just want you to know that it mattered, not just the outcome, the fact of it. She looked at him. She didn't tell him it was nothing, because it hadn't been nothing. She didn't perform modesty about it. She said, I know. He nodded once. Then he stood, carefully, the way he'd been learning to stand after the surgery, weight distributed deliberately, not trusting the left side fully yet, and he extended his right hand. She shook it. And then he straightened, with the specific effort of a man making his body do something it would rather not, because some things required the full version, and he brought his right hand up in a slow, precise military salute. Behind him, Reyes stood at attention without being asked. The two agents from Mace's office came to attention. Mace himself, who was not military and had never been, stood straight and was very still. Vega, who had come to the doorway to watch the discharge, went still with his hands at his sides. Priya, in the corridor, stopped walking. The salute lasted 4 seconds, maybe 5. Then Briggs lowered his hand and the room came back to its normal dimensions, and Claire stood in the middle of it in her blue scrubs with her hands at her sides. And she was not a person who cried easily or often, and she did not cry now, but something moved through her that had no convenient name, the specific, uncontainable feeling of being accurately seen by people who understood the full weight of what they were acknowledging. Take care of yourself, Sergeant, she said. You too, Bennett, he said. He left. Dumb. The commendation from the Federal Oversight Authority arrived 6 weeks after the arrests. It was formal, detailed, and used specific language about Claire's role in identifying the billing discrepancies, preventing the ICU medication sabotage, and providing material cooperation in a federal investigation of significant scope. A copy went into her personnel file. A copy went to the State Nursing Board. A copy went to the Federal Veterans Affairs Oversight Committee, which was doing its own review of the case. There was a ceremony scheduled, which she declined, not because she was being falsely modest, and not because she didn't understand the institutional need for ceremonies, and not because she held anything against the people who wanted to put her in a room and give her a plaque. She declined because she had a shift, and because the shift was real, and the plaque would be a photograph of a real object, but the shift was the actual work, and she had spent 31 years in a body and a life that was oriented toward the actual work, and that wasn't going to change because a thing had happened that other people wanted to make symbolic. Ferris, to her credit, did not push. What Ferris did instead was change Claire's title, effective immediately, to Senior Trauma Nurse and Clinical Liaison for Veteran Care, with a scope of practice that formalized what Claire had been doing informally for 2 years. The extended patient contact, the chart-level attention, the particular knowledge of how veteran patients experienced medical care and where the system failed them. The role came with an office she would never use and a budget line she would use constantly for things like extended consultation time and specialist referral coordination, and the small, expensive, unreimbursable interventions that made the difference between a patient who recovered and one who returned. She signed the paperwork for the new role on a Tuesday morning in Ferris's office, with a cup of coffee that came from a machine that had been replaced and was now, objectively, significantly better. She signed it with the ballpoint pen Ferris offered because her own pen was in her bag in her locker, and this was not a moment worth the 30 seconds it would take to retrieve it. She initialed where indicated, signed at the bottom, and handed the papers back. "That's it?" Ferris said. "Did you want a speech?" "I expected something," Ferris said, with the mild exasperation of a woman who had been processing Claire Bennett as a variable for 8 weeks and still found the variable resistant to categorization. "I appreciate the role," Claire said. "I'll do good work in it." She picked up her coffee. "That's the speech?" Ferris looked at her for a moment. Then, very briefly, she smiled. "Fair enough," she said. "Get to work." 3 months after Holloway's arrest, on a Tuesday afternoon between shifts, Claire went down to the trauma bay. It was quiet. Not the ominous quiet of a department waiting for catastrophe, just the ordinary quiet of a department between calls. Rodriguez was charting at the station. Kim, who had turned out to be considerably more capable than her 8 months of tenure suggested, was checking equipment. The bay had the clean, organized look of a space that was being properly managed. Near the trauma entrance, on the wall that had held a motivational poster about excellence in care for as long as Claire could remember, there was something new. It was a framed photograph, approximately 12 by 16, mounted level with the eye line of someone walking in through the ambulance bay doors. The image was black and white. She didn't know if that had been a deliberate choice or a printing decision, but it worked. It showed a man in a hospital bed, upper body visible, in a hospital gown with monitoring leads attached, his right arm raised in a military salute. Across from him, from behind, out of focus, a figure in blue scrubs, hands at her sides. No caption, no date, no names. She stood and looked at it for a long moment. She had not known anyone was going to put it there. She had not authorized it, and no one had asked her. And if anyone had asked her, she probably would have said no, because that was her default response to things that made her the center of attention in a hallway. But it was already there, and it was right. Not because of what it said about her, but because of what it said about the moment itself, that it had happened, that it was real, that a Marine in a hospital bed with 3 bullet wounds and a ruptured spleen and a medication pump that had been quietly adjusted to kill him had found enough of himself to raise his hand, and that the person he was raising it to had earned that gesture across years and miles and circumstances that had nothing to do with a badge or a title or what floor she was authorized to work on. "Who put it up?" she asked Rodriguez. He didn't look up from his charting. "Vega organized it. Priya got the print made. Kim found the frame." A pause. "Pretty much everyone contributed something." She looked at the photograph for another moment. "It's good," she said. "Yeah," Rodriguez said. "We thought so." She went back to work. This is what they don't tell you about the people who hold the line in the rooms where everything is at stake. They don't look like what you imagine. They're not the loudest voice, or the most decorated, or the one standing at the front of every photograph. They're the one who clocked in 12 minutes early and drank bad coffee and got fired by 9 and stayed in the building anyway, because staying was the only logical response to a man on a gurney whose blood pressure was crashing. They're the one who has been managing their way out of every institution they've entered, not because they didn't belong, but because institutions are built for predictability, and they are built for situations where predictability has already failed. They're the one who has been told, in 100 different rooms and 100 different professional registers, that they exceed their scope, that they don't fit the model, that their particular way of doing the work creates friction, costs time, complicates processes that work fine without them. And they have sat in those rooms and signed those papers and gone back to work, because the work was the point, not the rooms. They have made mistakes, they have been wrong. They have had days where the training didn't cover the situation, and they improvised, and the improvisation was imperfect, And they have had to live with imperfect outcomes the way everyone who works at the edge of life and death has to learn to live with imperfect outcomes. Not by forgetting them, but by carrying them into the next room and letting them make you more careful, more attentive, more present for the person in front of you. They didn't stay on Ashgrave because they were brave. They stayed because of the people who needed help were there, and leaving was not a choice their particular construction of self was capable of making. Bravery requires a felt alternative. Some people don't experience the alternative as real. And when the institution finally sees them, when the circumstances conspire to make the invisible visible, when the thing they've been doing all along can no longer be dismissed or managed or filed under exceed scope, they don't feel vindicated in the triumphant way you might imagine. They feel tired and relieved, and a little sad for all the time the misreading cost. And they feel the specific complicated thing that comes from being accurately seen after years of being looked at and missed. And then they put on their scrubs and they go back to the bay. Because the next patient is coming, and that patient doesn't know anything about the past 8 months and doesn't need to, and deserves the same thing every patient deserves. Someone in that room who is fully present, fully capable, and unwilling to leave. The work is not a consolation prize for recognition. The work is the point. It always was. The bravest person in that trauma bay was not the one with the most credentials on the wall, or the loudest voice in the meeting, or the title on the door. She was the one in blue scrubs who clocked in early and stayed late, and knew, without requiring anyone to confirm it, that staying was the only thing to do. She always knew. They always do. We just have to be willing to look.